are very happy that Dr. Nuruddin, the recipient of this Gandhi Memorial International Award, the recipient of this award. You know, Gandhi Memorial Leprosy Foundation is a voluntary agency established long ago, and it established recently this international award to be given to 2 people in every 2 years. The award consists of gold medallion, a citation, and 2 lakhs of rupees. Dr. Nuruddin was chosen for this award by the expert committee established by the Gandhi Memorial Leprosy Foundation. The foundation actually wanted to give these awards every year, but due to financial circumstances the award has been given now every 2 years. Dr. Nuruddin is the director of leprosy division in WHO. Earlier he was working in Tamil Nadu as medical officer. He has worked in Government of India. Then he was shifted or taken in WHO, and ever since he has been there, his attempt is to concentrate on the eradication of leprosy. Formerly, as you know, leprosy disease was treated by dapsone tablets and other things, but it was not giving the results which we wanted. It is Dr. Nuruddin, with his research methods and other thing, found out the method of treating as MDT, multi drug therapy, and this has been very effective, and he is an instrument in advocating of this MDT administration throughout the world. As a result of it, within the last 10 years, the number of leprosy patients has come down considerably. Therefore, it is very effective. Second contribution is that it is he who thought that unless we have some target date, there will not be much effective work. Therefore, he said that 2000 AD should be the end of leprosy or elimination of leprosy as a public health problem. And as a result of these 2 announcements and this administration of multi-drug therapy, we have been seeing now everywhere the number has come down considerably. Multi-drug therapy has been administered in almost all over the countries where as far as India is concerned, and in other parts of the world also. Doctor, I would like to know for the purpose of public and for laymen like us, what do you think of this leprosy as a disease which has been so shunned or shaded by people, and which is attached great stigma and other things? How does it occur, and what is the methods up till now have been tried, and you have been given the honor of this administration of the multi-drug therapy. What is this all?
Okay, leprosy is just like many other communicable diseases, a communicable disease caused by a germ. It is actually a bacterium which is called Mycobacterium leprae, as you can see in this picture, and the disease is spread from the patients to others, but it is a very feebly infectious disease. It does not spread as easily as many other communicable or infectious diseases. The disease has been present for a long time. It produces skin changes or skin patches in the person affected, and if the patient remains untreated, he can develop damage to the peripheral nerves, and which is the cause of all the deformities you see among patients who are not treated or neglected for a number of years. Leprosy still occurs in more than 70 countries in the world. This map shows you how the disease is distributed throughout the world as of 1995.
The highest is in India, it appears.
Yes, India is a major country as far as leprosy is concerned. Nearly 50% of all leprosy in the world occurs in India. But of course, a lot of progress has been made in recent years. I will come back to that later. Till about 1950, we had no way of dealing with leprosy except by taking them to leprosy hospitals or leprosy homes and isolating them. This is not at all effective and not at all feasible in most situations. So, in effect, leprosy patients suffered lifelong in those days. Then towards 1950 came a drug called dapsone, the first chemotherapeutic substance effective against leprosy. And this drug was used for treatment of leprosy in the 1950s, 60s and later on. And the drug was effective in treating leprosy, but it was a very slow acting drug and people had to take the drug for a very long time. Sometimes lifelong treatment was necessary with this drug. The second problem that came up with this drug after its use for 10 to 15 years was the germs causing leprosy, which I showed you earlier, was able to develop resistance against the drug. This is a natural phenomenon in many diseases and many infectious diseases particularly. What happens is, in any large pool of these germs, there are naturally occurring mutants which know how to resist the drug. And what happens is, when you treat a patient with a large pool of these germs, these naturally occurring mutants, which is about, in the case of leprosy, about roughly 1 in 10 million or 1 in a million organisms, are not affected by the drug. So, the germs which are able to be affected, they get killed all right, but at the same time the germs which avoid the effect of the drug stay there and they are able to multiply. So, over a period of time, the person who initially shows some good response to the drug stops showing response and he becomes worse, because now he has a disease which consists of the germs which can effectively resist the drugs and they are able to multiply and make the disease worse. The problem became much more serious as years passed on, and therefore, in the World Health Organization in 1980, we looked at all the strategies available based on the research efforts that have been made in the previous 10 years or more and all the options. And we came to the conclusion in WHO that if we use a combination of drugs, including drugs that have been developed in the previous years, then you may be able to fight the drug more effectively in the patients. What happens is, when you use a combination of effective drugs, you are able to deal with these naturally occurring resistant mutants. What happens is, any group of naturally occurring resistant mutants to one drug will be susceptible or capable of being killed by the second drug, and vice versa. So, with the result, if you have even if you have very large pool of organisms in this individual's body, you will be able to get rid of all the organisms by combining drugs, and this is now called multi-drug therapy. That means a combination of drugs.
How many drugs? 2 or 3?
Okay. Leprosy essentially has 2 forms of leprosy for the purposes of treatment. One is called paucibacillary leprosy or PB leprosy. These patients have fairly minimal disease and the number of germs they harbor is extremely few. So, for those patients, we think a combination of 2 drugs is sufficient. And then there is the other form, the more serious form, which we call multibacillary leprosy or MB leprosy. For this type of patients who harbor very large number of these organisms, we give a combination of 3 drugs. As you can see here, this is the 2 regimens we employ. The top one is for the multibacillary leprosy, the bottom one is for the paucibacillary leprosy. The 3 drugs that we use in the multibacillary leprosy is a combination of rifampicin, clofazimine and dapsone, and for the paucibacillary leprosy we use a combination of rifampicin and dapsone. The duration of treatment for multibacillary leprosy is a fixed period of 24 months or 2 years, and the duration of treatment for paucibacillary leprosy is a fixed period of 6 months.
Oh, that's good.
The results so far with the administration or use of multi-drug therapy throughout the world over the last 10 to 15 years have shown the drug is highly effective. Today we know leprosy is totally curable through multi-drug therapy, 100% curable. And that means as long as you are able to identify the patient, diagnose the disease, they are able to give the treatment as we are recommending, then there should be no reason for the patient not getting completely cured.
But if it is cured, do you think that his hands and feet which are mutilated or deformed could also be straightened or could be normal?
As I mentioned earlier, you have leprosy affecting the skin as well as the nerves, mainly the peripheral nerves, the nerves that supply motor function or and sensory function to the limbs, etc. And in leprosy, the disease after affecting in the early stages in the skin, later on starts affecting the nerves, peripheral nerves. And once the peripheral nerves are affected, particularly after some time, the damage that is occurring to these nerves are difficult to reverse.
My God.
The damage to these nerves means that patients can develop these mutilations and other problems which will be dealt with later. But the chemotherapy will kill all the germs, cure the individual.
So, he will not affect the others.
Yeah, but that is right. Not only that, but the permanent damage that has already happened to the individual, some of it is not reversible. It is like the case of a child getting polio. You can cure the child of polio. The child had already developed some paralysis, then these have to be dealt with in a different way. Now, coming back to the way multi-drug therapy has been effective in leprosy, we have found from WHO in all the countries where the treatment has been effected, patients accept the drug very well because they see improvement. Secondly, it is a very simple drug to use because it does not produce any side effects when the drug is taken. And secondly, everybody knows now that it cures patients completely.
But patches go away.
Yes, patches also will go away. But in terms of the numbers that we have been able to cure in the last 10 to 12 years, globally in all the countries put together, multi-drug therapy has been responsible for curing something like 7.5 million leprosy patients. Of this 7.5 million, India itself has contributed to 6 million. That is, in India, 6 million leprosy patients have been cured through multi-drug therapy in the last 10 to 15 years in different parts of the country. As you can see, the result of this was, as we were increasing the use of multi-drug therapy, and the result was we are able to reduce leprosy steeply. We can say now that leprosy has been reduced in the last 10 to 12 years more than 80% throughout the world, including in the case of India. Take for instance in India, in 1980 or even 85, we had something like 4 million leprosy patients, but today we have less than 1 million leprosy patients.
In a very short time we will be able
and
to.
Many states have done extremely well, some states have not done so well, but the progress is optimistic.
No, but it is also called a social problem. Why do they call it a social problem?
Because of the previous belief that leprosy is incurable, and because of the mutilation it causes, leprosy patients are ostracized in the society. There is a very strong social stigma against leprosy, which goes back to religious and other beliefs, and therefore the patients are shunned. But today leprosy is known as curable disease. There is no need for stigma. Already we are seeing in many parts of India a steady reduction in the amount of stigma and discrimination faced by leprosy patients.
That means what we need is education.
It needs education and also make people understand that leprosy is totally curable today.
Thank you, Dr. Nuruddin, for coming and explaining the things to us. Thank you.